everybody. As she said, my name's Allison, and I'm a pharmacist with Mizzou Specialty Pharmacy. I also work in the neurology clinic at MU, so I work with the doctors to help with Parkinson's patients. My goals for today is kind of give your brain a break for a little bit, and we're going to talk about resources and access to medications and costs. So I want you to understand what services you already probably have offered at your local pharmacy, and then make sure that you know that there are options for resources to help with costs of medication. And then I also, since I am a Mizzou pharmacy employee, I'm going to talk a little bit about our services as well. So we know already that medications can help with the movement disorder part of Parkinson's, and we also use it for the non-movement symptoms such as anxiety, depression, and sleep disturbances. And what that really means is that Parkinson's patients are more likely than the general population to be on 5 or more medications. And the reason that matters is because, one, our response to medication changes over time when we have Parkinson's. So as our Parkinson's evolves, our medications evolve. There's all kinds of different options. We have over 30 different options for Parkinson's disease that are specific to Parkinson's, plus all the ones that are the non-Parkinson's symptoms. People that are on 5 or more medications are going to be more likely to see their pharmacist a lot more. So while it's kind of a burden to be on that many medications, it does open some doors to give you more resources. So one of the things that I really want you to understand is that sometimes when we go to a pharmacy, we think of it as a store where we're coming home with a product, and we need to think of a pharmacy as a healthcare service to you and realize that you have access to healthcare services in between your doctor's appointments. So when it comes to Parkinson's medications and we're waiting on that next appointment to be able to discuss changes, sometimes a pharmacist can intervene and talk to you about maybe the goals of medication. Maybe they can help reduce some of the side effects that you're having. Sometimes we think of side effects as I'm having a side effect, so I have to stop the medication to avoid it. But there actually are things that we can do with medications to reduce side effects. That can be timing, that can be how we take them. And so a pharmacist can be a really big portion of that and help whenever we're in between appointments with our providers. It's really important in Parkinson's that we're optimizing medication so that we're getting the most use of our medications. And so a pharmacist can help with making recommendations on getting that optimization. We're also looking for safety. We're looking to make sure that the medications that you're taking with other medications or with other health states are safe. And sometimes we're that communication between you and your doctor when there are problems. I do have a list of some services up here that you may not know that some pharmacies offer. So your monthly, you can go back one slide. Some pharmacies have a program, like a sync program. They'll have different names for it, adherent, sync. The goal is that you can pick up all your medications at one time instead of having to go to the pharmacy multiple times. A majority of your pharmacies nowadays are offering some sort of program like that. And so if you feel like you're going to the pharmacy too much, that would be something to ask your pharmacist if you could work on getting it all at once. Some pharmacies offer special packaging that some of them are just like morning, noon, evening, and bedtime doses. Sometimes we can make it all in one package. So every morning dose is together. So those are great for people that are maybe having a hard time managing their own medications at home. That is definitely not every pharmacy. There are specific ones that you can order like online, but your local pharmacies, different ones have different programs. And if you tell your pharmacist, hopefully they would be honest with what programs they have or what's available. But there's definitely different options in the packaging that you get your medication. And then really important in this population is if you're having trouble opening your bottles, make sure that your pharmacist knows that. Because there are ways that we can change the bottle to make it easier for you to open. So that should not be a problem to get them to change that. Sometimes you just have to sign a waiver that says that you don't want child-proof caps. I do want to also remind you that over-the-counter medications, while they're kind of deemed safer for the whole population, that doesn't mean they're safe for everybody. So utilizing your pharmacist to make sure that the medication you're picking out over-the-counter is safe with your other medications or safe with your other health conditions or Parkinson's itself. So use that pharmacist to make sure that the medications you're picking out over the counter are appropriate. sometimes we can also read something or a friend can tell us, and like they're taking a supplement or a vitamin. There might be a variety of different options. An example is magnesium comes in a million different ways. And so if you're trying it for one option, you don't want to end up with one that's trying to treat constipation and give you diarrhea when you're really just wanting to sleep. So talking to your pharmacist about what your goal of picking something out over the counter is, and making sure that the one that you're picking is appropriate. So since I am from Mizzou Pharmacies, I did just want to kind of highlight some of the options that we have for Parkinson's patients. So we do have our normal 9 retail stores that are throughout Columbia. And then we also have the CAP Regional down in Jeff City now and Versailles. They're going to help whenever you fill at a health system pharmacy. There are some extra benefits to having resources. So one, we have access to your chart. So if you're not really sure why you're taking a medication, the pharmacist might be able to help guide that a little bit more than at a regular pharmacy that is only knowing that your doctor sent a prescription. I also have good communication when it comes to prior authorizations. So unfortunately, I'm sure most of you have came to a pharmacy to pick up a prescription to find out your insurance didn't cover it and your doctor has to do a prior authorization. Mizzou has pharmacy staff that's job is to do that. Unfortunately, it does get backlogs because lots of people have to have prior authorizations, but sometimes it can be a little bit quicker when we use Mizzou pharmacies because of that. But my position is actually with a specialty pharmacy. I'm not sure if you all know the term specialty because it can mean different things to different people, but specialty medications are usually very high cost and they have some risks with them and need a little bit more management. So my job in the specialty pharmacy is to work with the doctor to make sure that one, the labs are done, the dosing's appropriate, and that you know how to use it. Because if you're going to spend money on, or if your insurance is going to spend money on a very expensive medication, we want to make sure that it's getting the benefit it's supposed to. So my job is to educate you, make sure that you know what the goals are, and that you have realistic expectations of what those goals are. And then also we provide making sure that you can afford it and have access to it. So I do a lot of appeals for the doctors so they don't have to do that process. So when we do a prior authorization and insurance still says no, my job is to kind of fight insurance and get you access to that medication. Unfortunately, sometimes I can do that, and then your copay comes back really high. And so then my job then is to try to figure out what can we do to get those copays down. And I'll talk about that a little bit more too. So some medications that I do help with are Gocovri, Norians, Nuplazid, Northera, and Droxidopa. Those are in my circle because we have access. There are specialty medications that maybe have to go through a specific pharmacy. So Embresia is one that has to come from a pharmacy in Florida. There's only one pharmacy that has access to it. But there are other specialty medications outside of the ones that I am able to help with. So back to the resources of what we can do when we have those high copays. There are definitely copay cards that can help with people that have commercial insurance, which means non-Medicare, non-Medicaid, non-VA. So if you still are on an employee plan or a marketplace plan, you have access to copay cards and they can help reduce the cost of your copay. However, if you have Medicare, then we want to go to a patient assistance program and see if the drug companies have any programs to help with the cost of the medication. Some do and some don't. Usually those are for uninsured patients or underinsured, meaning that your insurance covered it, but your copay's not affordable. And then sometimes if your insurance denies it, they have programs too. And there's also free trial programs. And then a lot of companies provide samples as well. The thing is these are going to be branded medications. So medications that are already expensive. But sometimes we can get generic medications that are expensive. And there aren't these programs to help with that. And that's when we fall into grants. So there is different grants for Parkinson's. I don't know if you all can see them very well, but if you are savvy at all with Google, you can search Parkinson's grants and find them. But there's the Assistance Fund, that's tafcares.org, copays.org, the PAN Foundation, PAN Foundation.org, mwpf.org or healthwellfoundation.org. Those are all grants that are available to Parkinson's patients. Some of them are income-based, and I will say these grants are often closed with a wait list. But it's worth signing up for the wait list because when they come open, the people that signed up for that wait list would be contacted saying that it's open. These can help cover the cost of the medications. Sometimes it's just specific only Parkinson's medications, and sometimes it's all your medications. Also, back to Mizzou Pharmacy is that we do have internal grants and financial counseling at our access. So if you're filling it with a Mizzou Pharmacy and you tell us that you can't afford your medications, then our goal is to look for what options we have for you. There are also prescription savings cards that are available. GoodRx is probably the most common one that people have heard of. And GoodRx is nice because you can go to their website and type in the medication that you're looking for and where it costs at different pharmacies. However, there is some downfalls to it. It's not always super accurate. You do have to submit your information to them to be able to use it. So they then are getting your information. However, they can be significantly less. Even if you have insurance, sometimes it's better to use those to go than going through insurance. And then also, Mark Cuban has a pharmacy called Cost Plus Drug. Sometimes we do have to use that to get access to medications that are normally really expensive. So one that I've sent several times there is Droxidopa. It's a generic medication. There's no copay cards. There's no assistance. However, Mark Cuban can buy it at a really low price and be able to sell it. So sometimes we do have to go that route to get things when I can't find something else. This is a list of drugs that have copay cards. I probably missed some, but the goal is usually a branded name medication is going to have a copay card to help with the cost of it. Again, no Medicare or Medicaid or VA. That patient assistance program, so Norians, Ongentys, Rytary, Enbrija, Nupro, I'm sure I missed some as well. They have programs where you call the company, you tell them, I can't afford my copay. They let you know if there's options for you. And then sometimes we have to fill out forms with our doctor to send in a prescription to their specific foundation to help. One exciting change that's happening is if you do have Medicare, they have made changes for 2025. Anytime there's a change in a government program, I'm leery to be excited about it, but I do think that they're making strides to make it better. So no more coverage gap. The dreaded donut hole is going away. So that middle of the year high copay, if you are on expensive medications, should not happen. You are supposed to be maxed out at $2,000 of out-of-pocket medication costs. So if your max out-of-pocket for those copays should be $2,000 per year. They are also offering a program where you can go to the pharmacy and pay $0 at the pharmacy so that your copays get strung along throughout the whole year. So if you're on a really expensive medication where you would spend that $2,000 in the first few months of the year, you can opt for that program and get it spread out throughout the year. I don't have enough details to say if that's like the right move or not, but it is an option that you can look at. The other thing that I want to make sure people are aware of is that Medicare does have an extra help program. It's not well advertised, but if you are on a limited income but don't qualify for Medicaid also, there's kind of this middle ground where you might need extra help. And so that you can fill out an application. They do, the 2004 limit is $22,590 of an income, and you can't have more than $17,000 in bank accounts. They ask for proof of that. It is a process, but if you would qualify, it would be worth it because your copays are going to be less. They help with premiums and other costs. So it's worth, and that is on the Medicare.gov website. If you Googled Medicare.gov extra help, you would be able to find the application. Some local pharmacies would also maybe help you find the application and be able to sign up for it. Biggest thing that I wanted you to take away from today is that your pharmacist is a resource that you should be utilizing. You're going to the pharmacist or pharmacy multiple times, much more than you're seeing your doctor. Utilize that pharmacist when you're having issues. Talk with them, and don't be afraid to ask questions because those questions, whether it's about affordability or about side effects, they can really cause a conversation to happen and get things going. So thank you all. Have a good day.